Okay, time for another nugget. And this nugget is going to be a couple minutes longer than normal, but I hope you're going to take the time to get through it. In these confusing times, I think the two messages that I'm sharing here are very important. I thought about breaking it up into two nuggets, but I think we need to hear both of these messages at the same time here. So, as the COVID pandemic creates unprecedented disruption, fear, and uncertainty for all of us, my hope is to put a little perspective on the crisis in this nugget and to share an uplifting message I saw that reminded me to keep the correct perspective overall in life as well. So shout outs go to Robin Summers Foote, Kelly Price, and Dr. Andrew Stevens, who I don't know. Both of the articles I'm referencing in this nugget are posted on Facebook under their respective profiles. So if you'd like to check them out or forward them or maybe even give Robin, Kelly, or Dr. Stevens a comment or a thumbs up, please do that. First, I'm going to read a letter written by Dr. Andrew Stevens from the Cleveland Clinic. Dr. Stevens is a critical care doc at Cleveland Clinic, which is an absolutely world-class organization. His letter puts in perspective why there is such serious response to the COVID pandemic. I'll read it now and post it on the screen so you can see it as I'm reading it. Here we go. Dear friends and family, as you know, I am on the front lines of medicine as it is being called by the news networks. As both an emergency medicine physician and a critical care physician, I have seen a lot in my 20 years in medicine. I'm a little disheartened by people that do not understand the simple math we are dealing with and that think this is a hoax or being blown out of proportion. I have explained it to a few of my staff, and I can tell you they are having light bulb moments and suddenly understand. So please feel free to share and forward this with anyone you feel it would help understand the situation. I will underestimate the numbers for the people that like to be ultra conservative. Please read this in the tone it is intended, with compassion and the need to do what I love, help the sickest. COVID-19 is a relatively infectious agent, and for every one person that gets it, they will infect approximately 2 to 3 people. Actual number is about 2.72 people. With that ratio, we will and are seeing exponential growth. This means that the number infected will double every few days. There are approximately 300 million people in the United States at this time. If only 1/3 of Americans contract this disease, that would be 100 million people with the disease. Yes, it is true 80% will have a very mild course. On the other hand, 20% will not, and COVID-19 has a mortality rate or death rate of 1 to 2%. Let's say for argument's sake that it is only a 1% mortality rate. As you can imagine, these unfortunate people will be very sick before they die and need the highest level of hospital care possible at the time. They will need to be admitted to a hospital, in an ICU, on a ventilator, and being treated by a critical care provider like myself. So 1% of 100 million patients is 1 million dying or dead people. There are only 924,107 total hospital beds in the United States. Not even enough for the sickest of the sick. Out of the 924,107 total beds, only about 8% are ICU beds, or 68,558 adult ICU beds in the USA. Furthermore, there are only 62,000 ventilators, breathing machines, available in the entire country. So as you can see, we only have 1 ICU bed for every 14.6 patients that would die from COVID-19. We are woefully short the number of beds and ventilators we need to take care of these suffering people. Look at what has happened in China and Italy. We know that the reality is 6% or higher will need ICU level care, which would be 6 million people based on our 100 million people estimate. Now also remember that during this time period, people do not stop having heart attacks, strokes, getting into horrible accidents, needing emergency surgeries, having babies, or needing ICU beds. There are 19,996 full-time, board-certified or equivalent critical care physicians in the United States, with an additional 34,000 critical care trained nurse practitioners and physician assistants. So that's roughly 54,000 medical providers to take care of those ICU patients, almost one provider for one bed. Except remember, 1/3 of all Americans will get infected, to include your doctors and nurses. If you're infected as a medical provider, you can't care for another ICU patients without COVID-19, and you may need medical care yourself. So that only leaves 36,000 providers still able to work. Although that number will be way lower because we are at higher risk to get the disease based on exposure. Also, we cannot work 24 hours a day, 7 days a week for weeks on end. So that means only about 1/4 of the 36,000 are able to work at any given time, giving you 9,000 ICU level medical providers able to work. That is one available medical provider for every 111 patients that would die of COVID-19. Oh, I forgot to mention that 46% of U.S. physicians are over the age of 56 years, putting them in the high risk category for having a severe cause of COVID-19. 100 million sick with COVID-19, 6 million need ICU care, 1 million dying, 68,558 ICU beds available, 9,000 ICU available medical providers. What do? We must flatten the curve. But what does that mean? It means that if everyone gets sick at the same time, there is a very high peak or sharp curve that will overwhelm the healthcare system. But by flattening the curve, fewer people get sick at the same time, allowing for less chaos and more lives saved. We must slow the progression so that not everyone is getting sick at the same time and allow medical community time to help the very sickest. We need to slow the progression to allow the scientists to develop a vaccine or passive immunity. This is our chance, all of us, to make a difference. I can only save a couple lives, but together we can save thousands or even millions of lives. It might not seem like much by staying home, not going out, respecting other people's health and social distance. You can save a life. It will get worse before it gets better. But if we pull together while maintaining our social distance, this can and will make all the difference. I made a deal with myself when I started the practice of medicine to treat every patient as I would want my mother, father, sister, brother, wife, husband, or child treated. How do you want your loved one cared for in this time of need? Dr. Andrew Stevens of the Cleveland Clinic in Cleveland, Ohio. Hopefully, that information from Dr. Stevens puts the COVID pandemic and our country's response to it in a better perspective for you. So thank you, doctor. Now, the next message I'm going to read to you is much shorter and hopefully more inspirational for you. Anyone who has worked with me or studied success for any amount of time knows that one of the most important things you can do in life to stay happy, healthy, and get the most out of this life is to focus on gratitude. The habit of being grateful for things is so powerful. In this current crisis, it is so easy to find things to be upset about. There are endless things to worry and stress about. There is an abundance of fear and blame. However, there are also endless things to be grateful for. Robin Summers Foote put it about as good as I think anyone could during our present crisis. And I just wanted to read her recent post on this to you because it's so powerful. Here's what she had to say. I just want to say thank you. Thank you to the parents trying to keep their kids home and in quarantine. It is working and we love you for it. Also, thank you to the parents trying to let their kids live a little bit of a normal life and see a friend now and then. These kids have already lost so much. Thank you to the business owners who have sacrificed so much and closed their doors to keep everyone safe. And thank you to the business owners trying to keep theirs open so they and their employees can survive. Thank you for making modifications to keep us all safe while you do it, but still trying to provide for all of us. Thank you to our government and to our leaders for trying to make more tests available so people can find out if they are positive. And thank you for not allowing everyone to be tested, as we may not like what we would learn. Thank you to our schools for closing and keeping our kids, faculty, and families protected. Thank you for not giving up and for working so hard to educate them. Thank you for entrusting me to facilitate these last few weeks of school, because I have learned to respect and appreciate you far more, and it doesn't hurt me to be more involved in their education. Thank you, workers, for trying to work from home if you can. And thank you to those who are fighting to go to work to provide for your families and for mine. My point is, thank you to everyone for being human and for doing what looks and feels right for you and your families. It may not look the same to all of us, but I believe we are all doing our best. And for that true humanity, I am so thankful. Well, Robin, I am so thankful for you and your perspective. I hope that hits home for everyone watching this as much as it did for me. So let's wrap up. Take time, seriously take time to think about all the things you are grateful for and dwell on those things. Maybe like Robin, you can share it with the world. We all need more positive information right now to feed our brains with all the negativity that's going around. Thank you, Robin. Thank you, Kelly, for being positive leaders in this crisis. These two women are inspirations to all of us. And thank you to Dr. Stevens of the Great Cleveland Clinic for the great information and dedicating your life to helping the sick. No book recommendation this week. Just be safe and take all the precautions you can. Enjoy and take care of yourself, your friends, and your family. Help someone or multiple people in need and stay focused on all the things that you can be grateful for.